Good evening. I hope you can see and hear me. We've had a few tech issues, and it would help me massively if anybody who's just been chatting to me in the chat box could just tell me if you can hear me okay and can you see me. It says I'm live, but again, I'm just talking to the screen, so it's just really helpful to know that you can hear me. Thank you, Peggy. I really appreciate it. Thank you. That's great. Great. That's fantastic. Thank you. I'm going to make my apologies now. I'm running a temperature a bit shaky and a bit woolly-headed. I did have a thought about 2 hours ago I might not be able to do this evening. So if you bear with me, I may have that kind of red mist come down and not know who I am tonight. So that would be great. And I've got my hot drinks and I've got my tablets here. So hopefully we'll get through it. So really welcome to you on this Sunday evening in May. And we're looking at exploring canine muscle injuries and rehab. So for those who've been on these crowdcasts before, they're very interactive and I love it. I love that you ask questions and you've actually got a place along the bottom. So if we do, thank you, Jane. I'm hoping to. It hit me yesterday and I have to be honest, I was in bed this morning thinking about I've got to get up and get my energy back. Along the bottom line, there is ask a question. There's 5 questions sitting in there at the moment. If you want to ask a question, please put it in there. If you put it in the chat box on the right, what happens is it gets lost because the chat goes up as people add to it, and I might miss your question, and I don't want to do that because we've got people arriving. So welcome to those who are still arriving. So if you've got a question, I'm going to answer them all the way through. They're really important. That's how I learn, by asking questions. So please don't hold back on that. They're also time-stamped, and what that means is the recording is available just minutes after the live event. And so if you want to go back to a question and have a look at it, you can just press on the question and just go to that section of the crowdcast. We've got a chat box down on the right. I've got a few references and a few extra bits to add into there. My typing is super slow, so I'll try and get some extra information in there or some links as well. But if you want to chat or have some running comments, because it's interactive between us, please add your comments in there. I do glance at that. I don't have anybody in the room to help me with tech or with reading that. Most people have someone who reads and answers that. But so I'm trying to do all of it and keep it together. So I've got a great presentation, a little bit more information on this presentation compared to the others, but still some fantastic pictures of some wonderful dogs to share with you. So there's a poll. I cancelled the poll because I realised the poll wasn't really working for people. I put in muscles and just finding out which muscles maybe you've had experiences in working with or treating. And I've put in another poll because this is the last of the clinical section for these crowdcasts, unless of course you contact me and push and say I'd like something else. And what I'm doing is just slightly going into the professionalism and like top tips for setting up your centre, getting people through the door, getting your policies and protocols together, maybe your centre design, how to maximise your space or position equipment, or how to do clinic enrichment. So again, there's a poll running and you can just go onto the poll. It's along the bottom bar and add your vote as you go along. Anything else to tell you? No, it's great if you just touch base and come into, please don't sit quiet and just watch. Please just say who you are. Would love to know your favourite breed. Would love to know where you're practicing. Would love to know what you're thinking of the crowdcasts, because these are free and it's a fantastic way to share information across across the world really, because we've got people watching from New Zealand, Australia, America, Canada, South America, Asia, live, as well as watching the replays. So wherever you are, I really appreciate you giving up your time to spend a little time here where we can share our passion for dogs, which is what it's all about for me, definitely, and I know it is for you. So I'm just going to bring up the PowerPoint. Just going to have a quick drink before my voice goes. Excuse me there. Okay, so this evening it's about exploring canine muscle injuries and rehab. So when you're thinking about muscle issues, there's 2 main categories. We've got injuries to muscle, and we've also got muscle disease, which are your myopathies. So your myopathy presentations are classically, they're either like pain and hypertrophy, or weakness, collapse, and stiffness. And it's really important to consider your muscle diseases, because not everything is just a soft tissue injury. So for example, your fit, athletic dogs, they're prone to a metabolic disorder that's exercise induced called exertional rhabdomyolysis. And there's neurological problems which can cause Scotty cramps. So we're not looking at muscle disease in any way this evening. We're keeping it to muscle injuries and building on dogs in natural balance motion and all the other crowdcasts where I've been giving you information about CPGs, how dogs organize their movement. So sort of tidying that up and putting that into the outline, because at the end of the day, the muscles, they're the force capacitors. They're what give the dog the power to move. I'll just move my slide along. Again, I'm speaking, if you can hear me and see the slides all right, do let me know. So let's think of some real solid facts that are scientific facts with proven evidence and research behind them. We know that muscles are the force capacitor of canine movement. They provide the power of canine movement, and it isn't just about the size of the muscle. That isn't about how powerful a muscle is. So it's about the architecture of the muscle. So I want you to think about, if you go down a street or a road nearby where you live, think of the different houses, shaped houses you have. So in England, we've got bungalows, detached houses, semi-detached flats, terraces, but they're all places to live. So muscles are like that. They've got different architecture and different ways that their muscle fibers are packed into the muscle. So if you think of brachycephalicus, which is a really long, I just go back a slide. So brachycephalicus, can you all see my cursor on this lovely terrier here? So this is Lily. So brachycephalicus has got long parallel fibers and it goes from, well, it inserts into the brachium, the arm, and brachio, cephalicus in the head. So the names of the muscle usually tell you where they are. And that long strap-like muscle that's got long parallel fibers is great for high velocity, low force. So that's brilliant because it's the main protractor of the forelimb, which means it brings the forelimb forwards as it's moving. And that's what you want. You don't want the dog to have to think about lifting its paw up. It's just literally lifting it off so it clears the ground. So the muscle architecture of brachycephalicus fits with the function of it. Now, if you think of another muscle, you might think of a muscle like a leaf. Think of a leaf where the veins of the leaf are angled into the main vein. So that's a pennate structure. And what you're doing is packing in the muscle fibers. The angle of pennation is very important, and that muscle architecture is more about giving out power rather than about movement. So the architecture of the muscle fibers are really important as part of when you're thinking of the muscle power and the muscle activity. So is the PCSA, which is your physiological cross-sectional area. It's not just the anatomical cross-sectional area, so going across the muscle, it's going across the muscle fibers. So depending how they're arranged, different muscles have naturally got a design that gives more power, whereas other muscles are more about the velocity of movement. So the main thing about muscle power is not the size, it's about motor unit recruitment. And what that is at cellular level and fiber level, that's where turning the engine on. So think of your muscles as the engine of your car. It's turning that engine on, and we want to have everything in place so the muscle will work, but not all the engine has to work at its maximum for every movement. So think of you drinking your tea. So I've got my cup here. If my muscles, excuse me, I'm going to cough. If all my muscles had worked, then my drink would have gone over my head. So that's a graded motor unit recruitment in humans. Dogs are totally different, but they still have the same motor unit recruitment. So not all the muscle comes on to do every activity. So that's very, very important, turning the muscle on. And then also size has a part to play, but it is not the main part of muscles. So then we want to think a little bit about muscle plasticity. So this may be new to you, or you may know lots about it. Plasticity is the skeletal muscle's adaptive abilities to alter itself in responses to the forces and loading on it. So we see that every day. If you go training and you're going to do a run for charity, and you come into the gym as a human physiotherapist, I'm a chartered physiotherapist as well as a veterinary, well, a canine veterinary physiotherapist, I specialise in dogs. You could come to me and I could help get your quadriceps femoris much stronger and build the balance of your power in your running muscles. And that's because they're going to adapt. They've got an adaptability to training. They've got an adaptability to activity and to contractions and the loading of it. And so the muscle plasticity is something that we can use in our rehabilitation of muscle injuries, definitely. So then I want to talk about muscle contraction type. Any questions, do just bring them in, or if you want to say something, if you can hear me, that's fantastic. If I'm going too fast or too slow, do give me a bit of an indication in between coughing, that would be great. So what I want you to think about are the different kinds of contraction that the muscle does. We've got concentric contraction. And what that is the muscle shortens and gives out power. Okay, so if you think of your muscle fiber, your muscle fibers at fiber level. If you've not heard of the sliding filament theory, do look it up. It's the established and accepted way that, let me just put that in here. And that is something to look up and research around to understand at cellular and fiber level how a contraction actually works. But our concentric contractions, so if you hold your arm out in front of you. Oh, Paul, hello, can you hear me? Welcome, Paul. Yes, make sure you've got your microphone on, Paul. You should be able to see me. Yep, can you see me as well? I'm down in the corner. Yes, thank you, Alex, thanks. It's really hard doing it blind to a blind screen, so I'm guessing. Are you okay, Paul? Maybe refresh your page, Paul. Let me do. Yep, or use Chrome. Thank you, Peggy. Okay, we'll keep going. So, concentric contractions, isotonic exercise, these are dynamic contractions, so creating movement, okay? So put your arm out, put your hand on your biceps brachii here, okay? And then close your arm and you'll feel that contract. And what's happening, where the muscle attaches to below the elbow and up here, all right? Those are the origin is the nearest bit to the body. The insertion is furthest away. When that closes, that's contracting and shortening. So that's called a concentric contraction. Now, if I held a book, if you put your arm back out there and I held a book or a load on my hand and it's really heavy and my arm starts opening, biceps brachii is still working, but this time it's lengthening and giving out power. And that's an eccentric contraction. And the reason this is so important to know is that the majority of canine movement uses eccentric contractions. So we need to make sure that we put that into our rehab program at some point, whether it's in hydrotherapy, land-based physiotherapy, manual therapy as a musculoskeletal. Oops, refresh. That might be something to do. There we go. Okay, refresh the page. It can be to do with your Wi-Fi. You need good Wi-Fi for the crowdcast because we've got a big audience. So eccentric contractions, really important to know about those, understand those. Another way to consider eccentric contraction is if you run up a hill, you are running up the hill to the top of the hill and your quadriceps femoris muscles, your muscles on the front of your thigh are working concentrically. They're shortening to give you power. When you get to the top of the hill, okay, and you've made the hill, you're now going to descend. Now, if you run down the hill in balance, not falling over, but in balance, the same muscles are now lengthening and it's an eccentric contraction of your quadriceps femoris. Thank you, Jane. Thanks. Hopefully, Katie, you're back online. say, so that eccentric, as long as you're running in balance, the eccentric power you get from a muscle actually has a higher output than your concentric contraction. So it's very important to know. And I would say agility dogs, 99.9% of all their movement on a course is eccentric loading. So we definitely want to involve this in our rehabilitation programs. So isometric exercises, these are static. This is where if you just literally now tighten up your biceps brachii on your arm just by making a fist and really clenching it hard, but you don't move anything. That's an isometric exercise of that muscle. Okay, so that's a static. So a few more really interesting facts just to think about is the general rule. This is a general rule. Please don't tell me the one muscle you can find that doesn't stick to the rule. But the general rule is muscles that are laterally placed on the dog or superficial, so just under the skin, they're more to do with movement. Whereas your deeper placed muscles, really near around the joint, or your medially placed muscles, the ones that are on the inside, their major function is more about stability. So think about you standing up now. If you want to have a stand up, stretch your legs and then just stand on one leg. You've got the muscles with the leg lifting off the ground working and producing a movement, while the leg that's supporting you, those muscles are working and giving you stability. The overall effect is that you've raised a leg and you've kept your balance. So muscles have key functions, and then they also have additional functions. They have loads of layover, so the dog's got something organized for all circumstances. They're very adaptable. So, excuse me a minute. For those who've just joined me, I'm really sorry. I'm not very well. I'm running quite high temperatures, so if I look a bit red and I'm a little bit shaky, bear with me. We're going to get through this together because it's worth it. It really is some useful information for you. So, the other thing to think about is that with your muscles, where they attach, the attachments, the origin is the part nearest the body, the axial skeleton, and the insertion is the furthest part away from the axial skeleton. The origin and insertion, that's where you've got the greatest pull. So it would make logical sense. That's where you're going to find injuries very often. Oh, well done, Katie. Thanks. Welcome back. Great to see you got back on board. Great, Bernadette. Thanks for that support. Okay, so here, this is about the central pattern generators. And again, if this is something new to you or you've not really heard very much about, go and have a look at the dogs in natural balance motion crowdcast. We went through it quite a lot. So I want you to think of the proprioceptive system as your computer. The incoming into your computer, the afferent information, which comes from inside the computer and externally, so from inside the dog and externally through receptors, most of it's gathered into the main computer. And the majority of information is stored in that computer. Only a small amount of that information then goes down the efferent or the outgoing information towards the muscles. Most of it is stored in the memory banks. And then the information that goes out of it to the muscles tells the muscles what to do. So that's your innervation. It's your neural system. Now, in humans, we only have a few CPGs because the way we are wired, we move totally different to the way the dog's organized to move. In the dog, they've got a lot of CPGs in their thoracic and lumbar spine, a huge number of them. And they're like mini computers that are linked to the mainframe. And their activity is to give out a rhythmic output. And what we know from established research is that CPGs generate walking and trotting in the dog. CPGs generate rhythmical sequences, so they're responsible for the swimming action that a dog does. So your CPGs give out a rhythmic output, and they are the main organizers and the drivers of canine gait. So if you're involved as a therapist working with dogs, you want to know all about these CPGs and understand their role and function in the dog, because it's really different to that in the human. Excuse me. Okay. Hopefully we've got the same slide. So here we go. So we're looking at, we're thinking about different kinds of how we have muscle injuries. We can have direct trauma, which can be contusions, lacerations, strains, ruptures. contractures, myositis ossificans, ischemia. So I want to just talk about contusion and strain, really. So contusions, this is where you have direct trauma to a muscle and you have an injury. Whereas a strain, that's where the muscle has had excessive forces through it, and what the loading does is there's a failure of those muscle fibers. And they're the two that you may see commonly, along with the rupture, which obviously is really due to usually excessive strain, excessive loading, and can be very, very damaging. And then we've got indirect trauma. So this is where you get damage to the surrounding tissue. So an example of this is when the dog has fractured its bone. It's unbelievable, but 4 times that force goes through the surrounding soft tissue around it. It has a hugely negative impact on the muscle function around it. And as much as we want to heal the bone, the preservation of that soft tissue is absolutely paramount, because that's what moves the dog. The bones have no power of movement. They don't move themselves. The joints don't move themselves. They are moved by the muscles. So muscle injuries are profoundly have a profound impact on the efficiency of the dog's movement. So they're very subtle, a lot of muscle injuries, and often missed. So this is about an outline of thinking about the muscle injuries, because they're difficult to detect, some of them. But if you know where they're liable to be, these are the areas you can investigate a little bit further in your assessment. Oops. Just trying to bring on the other side. So now I'm going to just have a little bit of a think about some more muscles for strain and rupture. Traumatic muscular injuries are by far the most common MSK or musculoskeletal injury that we see. They're most common in the athletic dog. And the reason for that, like your working dogs, agility dogs, racing dogs, is because you've got these high forces and loads going through the muscles because they do high speeds or athletic activities. So sporting activities lead to sporting specific injuries. So you will see very specific injuries in agility, and they will be different to in your gun dogs and your working dogs. And you need to be thinking of these high acceleration and cornering speeds. So if you relate that to your pet or companion, throwing a ball and the dog running in a straight line isn't the issue. The issue will be slamming on the brakes and then that tone. The issue is where the dog's so excited, it has really high acceleration to go and chase the ball. So those are higher forces than the dog running. So you're really thinking about what elements of your dog's activities have got high acceleration and braking speeds and cornering speeds, because these lead to really high stress and strain on those muscle tissues. And the forces we're thinking about, so we've got the force of gravity on the dog, and we've got the ground reaction forces between the dog's paw and the ground. So we've got that gravitational force, we've got the ground reaction forces. When the dog's turning, we've got additional forces because we've got centrifugal forces. So we've got more forces, so it's more complex and much more loading and much more stressful for the tissues. So then as a rehab strategy, we would definitely want to use straight lines because the dog is designed to move forward in the straight line. Biomechanically, it's a model that is designed to go forwards in the sagittal plane. And then we've also got to think about the surfaces. So lots of muscle injuries can come because of the slip and slide of the dog's paw on the surfaces, and you'll see that in agility depending what the course is made of, whether it's a carpet, whether it's grass, whether it's sandy or rutted. Frictional with the racing dogs on the sand, it's really important for a great track and track design and track surface, because if you've got slippy sand on the top, you're going to have these frictional burns as well. So again, it's looking at the different forces that the dog is contending with. So obviously your companion animal running out there on a rutted field, there's going to be a lot more forces, undue forces through the musculoskeletal system than on a grassy plain or in the forest on a sort of like more like a gym floor where there's it's a bit more absorbing the concussive surfaces, the concussive forces through the dog's paw. So you can relate these principles in the working and athletic dog as well to your companion animals. So somebody, I can't remember now, I'm really, I can't remember who it said, but they love boxers. So this is for you. This is a wonderful boxer bitch that I had the delight to work with. And she was just lovely, lovely natured dog, very noble, very gentle, brilliant with her family of children. So muscle injuries, the issue with it is that after 24, 48 hours, when you're looking at that muscle tissue, there may well be, if it's a stoic dog, depending on their behaviors as well, there may be no obvious pain. The information you're going to get is quite subtle. The dog's moving again. You may not have very many signs or diagnostics to pick these subtle muscle injuries up, and they can accumulate into a massive injury later. So it's being aware of the activities of the dog and being aware of which muscles are more prone to injury than others. So you can search those and investigate those. And missing subtle injuries can lead to misdiagnosis as well, where, for instance, TFL, tensor fasciae lata, the second most commonly injured muscle in the pelvic limb, in the hind limb in the dog, is often missed and misdiagnosed, because after 24, 48 hours, maybe you're not seeing what you did immediately with the muscle injury. So the sooner you see these injuries, the better it is for you to be able to address them. If you've got a lameness that's going on after 48 hours, 3 days, you really are starting to think this is going to be ligamentous, it's going to be a tendon, it's going to maybe be a joint problem. So that's why it's so important you work closely with the vet to get that accurate diagnosis. So your muscle analysis skills, you're going to use clinical palpation with therapeutic handling. And I want you to think about this. If you're feeling cold, what happens to your muscle tone? If you're cold, does it increase? Does it get less? Have a think about it. If you're angry and you're really upset about something, think about your muscle tone, maybe around your neck and your shoulders. Does your muscle tone increase? And then have a think about if you're really scared or worried, really upset about something, your muscle tone is going to change. And if you have a muscle injury, your muscle tone may change. So this is where, don't just look at it from your perspective, try and analyze the dog in context of the situation, because it may be they're overwhelmed at being palpated. It may be that they've never been in a clinic environment before. It may be that they're picking up signals from their human owners who brought them in and they're anxious, and that's building up the muscle tone. So don't search muscles just from the perspective of looking for injuries. Use your therapeutic handling and your clinic enrichment to introduce touch so it's therapeutic and can pick up those signals to identify muscle injuries really accurately. And working with the dog, not on the dog, which is so important. Excuse me, I'm really sorry, I'm just going to have a cough. Okay, so we need to know about the muscle injury itself, and it's really important. So any questions so far? We've got 5 questions, sitting and ask a question. I had a peek at some of them. A couple are really about muscle disease or neurological problems, but I'm very happy to chat about that. Can you still hear me and see me, everybody? It's gone quiet in the chat box, so just checking in with you guys. Yes to both, thank you, AKSJ, that's brilliant. So I want to just think about thank you, all good, thank you, Paul, great, that's fantastic, and that you're on there. So we need to think about muscle injuries. Thank you, Jane. Thank you, Caroline. Welcome, Caroline. I didn't see you get in. I haven't seen the list. So once I close the list and go live, I don't get to see who joins. So really nice to welcome you this evening. So we need to think of causes of muscle injury. They're going to be internal or they're going to be external. And we need to think about the different factors that can cause injury, because when you chat to your human owners who've come in with the dogs, they give you so much useful information. So if they're a working dog or an athletic dog, you want to know about the surface track, the surface design. You want to know about the course if they're agility dogs and the course surface that they've been working on. You need to think about the method of deceleration. How do the dogs, so complicated design courses with lots of turns and breaking into tight turns are going to have much higher forces on the dog than a bigger running track or a bigger running course or design. We've also got to think about the fitness of the dog for the role that they're doing. We need to think about dog-to-dog interaction if we've got more than one dog working in an area. So if you've got groups of dogs where they're racing, you can have dog-to-dog interaction, and also dog-to-equipment interaction. So if they're on an agility course, if they're doing anything with equipment or edges or sides, and they've got any kind of contact with that, or there's any grit on the course and they get a paw injury while they're moving at speed. All of these factors are going to be in your assessment where you're wanting to find out about it. We also need to think about the weather and environment. So that's an external factor, and we definitely know different surfaces, different weathers, cold, heat, raining, where the water's not draining off, definitely leads to much higher stresses and strains through those muscle tissues and leads to that injury. And we need to think about the dog working in balance and if they're carrying any subtle underlying muscle injury already. But when you're looking at the nature of the injury in front of you, we need to know, is it just a muscle fiber injury, so a minor muscle injury, or have we got the muscle sheath, the fascia that surrounds the muscle, which is like strong, elastic, mobile? It's like an envelope around a letter. Has that been damaged? And if it has, you'll palpate it and feel like a hole in the muscle tissue, or it might feel like corrugated, kind of like a corrugated side where you can feel that the sheath has been damaged as well. It might be a combination of the two. And muscle injuries, they are graded, but it's just an arbitrary grade to give you an idea from whether it's a minor muscle injury or if it's something really major. So whatever kind of injury, we're going to have this process of there's going to be pain there, because muscle is hugely innervated. It's got a fabulous blood supply, but it's also innervated really well because the innervation, the nerve that goes into it, also it turns it on and off, but it's also got a sensory supply as well. And the pain, just like if you've got terrible pain somewhere, your muscle protects you. Like scaffolding, the muscle goes into muscle spasm to stop the movement. It's a natural safeguard for the body. And this protects that area, and then the nature of that is that you will have reduced active range of motion of that area. And what you will have then is something called functional compensation. And if the dog uses functional compensation and it's not resolved, they're going to be moving very inefficiently and out of balance. They'll be loading structures abnormally, and long-term, they can lead to secondary patterning, which again is this functional compensation. Excuse me. So a very frequent mechanism for muscular injury is going to be these stresses and strains that the muscle experiences. And you've got to really think, you get a lot of training injuries because of the stresses and strains that training regimes put through the muscles. Now, the point of training is to build up that muscle power and efficiency and motor unit recruitment so that it can be called upon and to work at its best in competition. So there's a real balance between training and rehabilitation. There's a link to the two, but you've got to be really careful and listen carefully to what they're doing in their training programs, because it may be inadvertently an activity or a particular movement or a particular way something was introduced to the dog, and the repetition of it may have lent itself to the muscle being injured. So we've got to ensure that we're assessing after their training as well as after competition. So it's looking at the dog holistically for all their activities. Also, in competition and in training, dogs don't think, I'm only training, I'm going to just take it easy today. They're working at maximum, and so these high acceleration forces, turning and cornering forces that they have to contend with, has an effect on their tissues. So we're looking at their fitness levels, the time of the day they train, the amount of training, how it relates to their competition, and that's where they're going to work really closely with their trainer to organise a program that is proactive in making the dog as fit as possible for the role it's going to do. So you would never, as a hydrotherapist, have a racing greyhound in there and do aerobic work. You're going to do anaerobic conditioning. And you would never, for an endurance dog like a fantastic Siberian Husky, use an anaerobic conditioning, because you would want to do aerobic conditioning because the nature that they're an endurance animal. Otherwise, you're going to be affecting the balance of their muscle tissue, which is genetically enhanced through their training program and their genetic makeup, and taking away from them the power that they need for that particular activity. So that balance is really important to work with your trainers. And then it's looking at whether you've warmed up the dog, whether you've got a cool down procedure, and it being appropriate for the role of the dog, which will be different for different dogs. So when we're looking at tissue healing, the healing process is exactly the same mechanism as other tissues. So you're going to have an inflammation part of the healing process, a repair process, and then your remodeling process. And the repair and remodeling have a huge overlap. And I think one of the questions that came in, this kind of relates to really understanding what part of the healing process you are looking at when you're introducing your rehabilitation, because you need to be very mindful of the stages of healing, whether it's acute, whether it's chronic, and what part of that healing process you're in, because you're there to be beneficial and enhance and speed up and optimize the healing, not jeopardize it by doing something inappropriate at the wrong stage of healing. So the healing is going to be determined by the injury, the type of injury that you've got, and also the severity of the injury. And it's all about that scar formation. So when muscle is damaged, the regeneration of muscle tissue, that's your plasticity and your regeneration of it, sits alongside with your scar formation. And the most important thing is that we want to have organized scar formation. So if the injury is just left to heal by itself, think of pickup sticks. The muscle fibers, when they heal, it's just like throwing that game pickup sticks or a box of matches all on the ground and they all mix up. What we're trying to do for getting excellent scar formation that will support those athletic stresses again is to get really good alignment of it. It impacts that muscle fiber regeneration, and too much scar formation is going to interfere with that muscle contraction. It's like having a lot of gum in the works. So that muscle contraction, that sliding filament theory that I put earlier on in the chat box to have a look at, is really important. And if the scar formation interferes with that muscle contraction, you'll have something called functional inhibition. Basically, the dog will not be able to organize the power, but their mindset and their determination will be to move their body through the role that they do, whether an agility dog, but physically they can't perform at that same level. So looking at excessive scar formation and preventing that is absolutely paramount. So we know from research, I'm sorry, at the bottom there, it should say Fitch et al., not et al. Slight typo on my behalf. The functional muscle regeneration, we know, needs 5 things. We need a nerve supply. It has to be innervated. So innervation is the nerve into the muscle. If you've got denervated muscle, you have no muscle being told what to do by the neural system. So the engine of the car is told what to do by the car management system. Your neural system, your proprioceptive system, is your laptop, and that whole system that tells the power of the dog what to do, and the power comes from the muscles. You need preservation of your extracellular matrix. This is at cellular level, so we need to preserve that. We need a source of myoblasts. They're your muscle cells. We need blood supply. We all know that we need an adequate blood supply, and we need limited stress across the wound. So too much stress will undo or be retrograde to the healing process, and no stress, immobility, can cause just as many problems. So it's just getting that balance just right. So to move or not to move. So as I said, premature mobility, you are going to increase the tissue granulation and the scar tissue. And we've just explained, like, excessive scar tissue is not what we want to do. So understanding that, you know that to move the dog too much, so the dog to engage too much movement with that muscle early on will increase the granulation tissue and increase that scar formation. However, prolonged muscle immobility, so you might be thinking, well, let's just keep it really still. Prolonged muscle immobility is going to lead to irregular orientation of those muscle fibers, like those matches plonked down, or the pickup sticks just plonked down and just randomly arranged, is going to be a real problem, because you'll have excessive scar contraction and you'll have decreased tensile strength. So the muscle will not be able to power as efficiently. So we don't want to move too soon, but we don't want to keep it still. We need to get it just right, and that's controlled motion and stress. We know by research in the later stages of healing promotes that functional parallel orientation of that regenerating muscle. And that's what we want, to optimize that muscle working efficiently again, so it can produce the power needed as part of the overall engine for the dog to do the job or to do the activity that it wishes to do. How are we doing? Any more questions on that? Everybody still hearing me okay? So I'm going to look at some treatment aims. Just watching the chat box. Thank you, Jane, for coming in there straight away. That's fantastic. So the optimum, thank you, great. Yep, great. Okay, so we want to know about optimum healing environment, the optimum, how to optimize that healing for that damaged muscle. So our general treatment aims are what we're looking for to achieve through our rehabilitation of our muscle injuries. And they're listed there on the left for you to see and to just read through. Our optimum treatment is going to be very dependent on which muscle is injured. It's going to be the site of the muscle injury. It's going to be that location and function of that muscle. So a major power muscle injured is going to have a major effect on the powering of the dog. And the location, so if you think of the most commonly injured muscle in the racing dog, in the hind leg, is gracilis. It's a huge flat muscle which you find on the medial aspect of the thigh, but it's superficial and it's huge. And the caudal fibers of it are almost vertical. And in the racing greyhound world, they call it the back muscle, but it's on the inside of the thigh. So the origin is really high up, very inaccessible, and the insertion is lower down. So it would be much worse to have an injury of the origin of gracilis, where, especially a rupture, where it will pull down and you'll feel the shape of the muscle change, than the insertion. So the actual location of the injury, as well as the function of the muscle, has a big impact on its recovery. We need to know the severity of the injury. So the severity of the injury, if it's a minor injury, is going to heal quickly and well. A more severe injury is going to take longer. And we're talking about, until you've got that mature scar formation to support the athletic stresses, usually about 4 to 6 weeks for many muscles, sometimes a little bit longer for some others. Gracilis muscle, if you wait for that to heal and don't do any work with the dog, they will never get back to racing. So you do need to understand the nature of the role of the activity in depth as well, because that will tell you the demand on the muscles. So the site of the injury and also the time frame. If you're seeing the muscle injury straight away, you can do so much, because you understand the healing process, you understand how to optimize it. You're not going to do anything that's detrimental to the muscle injury repair, because you're aware of the healing process and what you can do and you mustn't do. But the longer you leave that muscle where you're not bringing in some rehabilitation and some different strategies to recover the muscle over that injury, and it becomes a chronic injury, the harder it is for you to then achieve your progress. So treatment is going to be two key things. It's going to be conservative, okay, which is where the paraprofessionals come in, your physiotherapists, your osteopaths, your manual musculoskeletal practitioners, your hydrotherapists. So this is a conservative approach where we are working with the dog holistically and engaging specific target strategies locally for the muscle group and the muscle, as well as holistically for the whole dog. And then you've got surgical intervention, and you may have a combination of the two as well. And so really a treatment is looking at the role of the therapist, where you're coming in and your knowledge of the sport or your knowledge of the activities, your understanding of the healing process, and working within your scope of practice using the strategies that you're trained to use. So just one last slide, really want to think about is adaptive muscle shortening. So this is a major impact on athletic dogs and elderly dogs. You see it as well, where muscles shorten and change their nature so they are not useful and efficient at movement or at generating power. And adaptive muscle shortening can result from immobilization. From keeping still for too long, the muscle will shorten and adapt. Also, it can happen when there's reduced mobility. So those older dogs going off their legs, less range of motion, and basically their general mobility and then specific mobility is getting less and less, muscles will shorten and change. And you will feel that in your elderly dogs that tend to drop down at the back end and squat down a little bit more. And when you go and feel their calf muscles, their gastrocnemius, they're really, really hard. And they've shortened and tight. You've got adaptive muscle shortening, and they've tightened the muscle tones really, really hard because they're overusing those, because their hamstrings at the back of their thigh have kind of lengthened and gone quite soggy and long. So again, this is adaptive muscle shortening. This is where it's changing. You can have it with all injuries. So it's really important to get the extensibility back of the muscle length back of the muscle and its activity levels back, as well as the power. So you would never go into strengthening straight away. Strengthening in your muscle program always sits to the back end. You want to get the muscle turning on. You want to optimize the muscle length, its extensibility, and then start building in your strengthening program later on. And adaptive muscle shortening, we know from research, leads to less muscle power. And the muscle is not generating the power. However, these fantastic dogs still have the mindset and the motivation, especially your high drive dogs, to work at the level that they always work at. But physically, their body cannot meet that demand. So unfortunately, very often these small minor muscle injuries that are missed become a really major muscle injury that is devastating to the dog and to the owner, and needs a lot more rehabilitation. So just hopefully you found that interesting, and just going back to the general treatment aims. Excuse me a minute, just going to have a cough. I really apologize, anybody joining a little bit later. I'm running a very high temperature. I'm a bit red and shaky, so I'm not in best form, but I'm going to go to the questions now and see what questions we've got. So if you would like to ask a question, please just type it in to ask a question along the bottom. And you've had upvoting. So what happens with the upvoting? You can vote for the question you would like asked. So if I could just ask you not to vote for any questions for the moment, because I can read the question out to you, but if you vote, it disappears. So I'm going to start answering, how important is time related to each stage of our plan for an effective muscular rehabilitation? Thank you, Richard. That's a very pertinent question. It's really a useful thing to think about. So there are some, excuse me a minute. There are some things that we know from the healing process. So in your inflammatory stage, early on in the muscle injury, you would never use massage therapies. I would never use them in the first 4 days, but most people say for the first 48 hours. That mobility that's local around that muscle tissue will be really detrimental to the healing process. Whereas massage therapies and manual therapies you can introduce later on at the appropriate time in the repair and remodeling phase of the healing process are going to be incredibly beneficial. So knowing which to do at what time. So if you're a veterinary physiotherapist and you're using an electrotherapy, we know that it's really important the settings that we use, the parameters that we use on our pulse mag therapy, our parameters that we use on our ultrasonic electrotherapy, our laser, muscle stims. You're not going to use them anywhere near a muscle injury early on. Absolutely not. and the dogs don't like them anyway. You're going to use an electrotherapy that the dog can work with, but you know the settings that you use in the acute phase, the subacute phase, and the chronic phase are going to be totally different. So again, these are bits of equipment that veterinary physiotherapists have trained and understand the in-depth use of it. I think the concern is these days that so many people are buying pieces of electrotherapy with really well-intentioned, but maybe don't quite understand that it's a balance of using it. It's an art and a science. You need to put enough of that energy into the tissue at the right point of the healing process to generate and optimize the healing environment. If you use the wrong parameter, put the wrong setting, you're actually going to detract, and it's going to be really detrimental to the healing environment at that moment in that healing tissue. So you will probably be changing your parameters at different stages of that healing process. And it is of great concern. So many people are buying kit and using it, whether it's things for their exercise therapy, whether it's electrotherapies from Boots, or they're just buying it online. And they mean well, but maybe they'd be beside themselves if they thought the setting they're using at that moment, or they didn't know there was an underlying muscle injury, so they're using it for something else, would actually be detrimental to the dog. So understanding how to use these parameters and manipulate them to fit with each dog's individual program is really important. Again, with your exercise therapy, whether you're using hydrotherapies or land-based therapies, understanding the different way you're going to manipulate the parameters of your water properties in hydrotherapy, the different stages of healing is really important. What you're going to do statically and what you're going to ask of the dog dynamically, whether you're going to fatigue a dog or not fatigue a dog. So that's really important. You would never fatigue a neurological patient in a hydrotherapy setting. You do not want to push those muscle tissues to fatigue. Early stages of healing, you do not want to fatigue or put too much stress through those tissues. Later, if you're in your strengthening program, much later on in your remodeling phase, you absolutely want to use a strengthening program where you fatigue the muscle tissue. And you need to understand how to do that in the medium that you're working on, whether it's land-based controlled exercise, whether it's water-based controlled exercise and activities. So fitting the program for each dog, and it really depends on their role as well. So understanding what sort of energy conditioning you're doing. So energy partitioning is so for your aerobic activities where you've got dogs that are endurance dogs, where they're picking up, where they're gun dogs. You're going to use a lot of aerobic conditioning work within your exercise program. You wouldn't use anaerobic. Whereas for a dog that's an anaerobic activity, so your agility dogs, your racing dogs, that's their main energy partitioning. You are definitely not going to do aerobic activities with that dog because you will actually deplete its ability to perform at its best. So that balance is really important. That's a great question. I hope that answers it, Richard. So that the next question I've got is, what are the best techniques and exercises for strengthening core muscles in a non-ambulant dog? So it really depends why the dog's non-ambulant. That's the first thing. I'm talking about muscle injuries. So it would have to be a profound muscle injury for the dog's pelvic limbs or hind limbs to be weak and thoracic limbs to be strong. And whether that is a muscle disease, whether it's a neurological condition, whether it's an orthopedic condition, but techniques that you're going to look for engaging core muscles, we want to turn them on first. And so probably doing some balanced stand work and engaging the cores, understanding how to switch the epaxials on, doing some rhythmical stabilizations. Again, think about the dog is designed to move forward in the sagittal plane. So it's incredibly important. Rhythmical stabilizations match the biomechanical design of the dog, not humans. And so because of that, you would do cranial caudal shifts. Because otherwise, if you do side-to-side shifts like you would do on a human, you're going to generate a gait pattern, which isn't what we're trying to do. We're trying to engage the muscles that are really responsible for retraction. So your retractors are the muscles that have the power sweep backwards. okay, against the ground. So where the paw meets the ground to mid-stance to push off, that's your retraction phase of the limb on the axial skeleton. That's your power sweep. Protraction is the forward movement of the limb on the axial skeleton. That's getting ready for loading. So that's in the air. So the key is your retraction power sweep. So if you want to make your dog stronger, you're going to concentrate on that. And that is in a cranial caudal movement. So I think really looking at actively engaging muscles using proprioceptive enriched activities are far superior than a muscle stimulator. Because the problem with your muscle stimulators, first of all, the dogs don't like them. They really don't. And some breeds really deteriorate if you use them. And we've got that in research as well. So be really careful with those. Also, muscle stimulators are designed to recruit muscles superficially to deep. And when the dog is working and recovering and you're rehabilitating or you're training, naturally humans and dogs recruit deep to superficial because the key stabilizers are deep and medially placed, and we want to engage and get a really strong bed of support for the superficial, more laterally placed muscles to work and move the dog. So doing proprioceptively enriched activities that are actively engaging with the dog, where they actively decide to work with you, are hugely beneficial to engage that core compared to using an electrotherapy. The electrotherapy may have its place in inpatients, or it may have its place where you've got denervated muscle or a neurological condition, but I would always opt for proprioceptively enriched active work. And even if the dog's non-ambulant, I'm going to get it into that standing position or a postural position where I've got some loading and compression through the joints in a normal position. So I hope that helps with that question. So how are we doing? Any more questions? We've got a few more to go. So the next question I've got is which muscles, start answering, I'm just going to timestamp it, sorry. Which muscles are key to, I don't quite understand the question. Bernadette, you're going to have to help me. It says, are key to far all continence in a dog and how can we affect them? I'm not quite sure. I think that there's a few typos in there. So Bernadette, if you want to put something in the chat box, just help me. Fecal, aha. Are key to fecal continence in a dog and how can we affect them? So we're going to, okay. So when we're thinking of continence or incontinence or problems with that, we've had these amazing successes with our elderly dogs, particularly with some of our mobilization work that we've done around coccygeus, the muscle around the tail, and some tail work. We weren't looking for that. What we were doing, we were looking for engaging epaxials, and we were looking for affecting positively the balance of the dog. But the side effect that was being reported over years was that in the elderly dogs particularly, people were saying their continence improved significantly. Really looking at coccygeus, really looking at the tail position and alignment. And when I'm talking about tail mobilization, I'm talking about the gentlest, subtlest movements like canine pilates. So there's no traction, there's no big movements. And we've got a really brilliant underwater video of a lot of the tail techniques that we use that's going to come out in a course that we're going to launch in the elderly dog. Just showing you lots of techniques for the elderly dog who's struggling to stay on their legs, who's getting stiffer, getting slower, getting weaker. And one of the videos that we've got in there are canine technical videos showing you in detail every moment of the treatment. Shows you this tail work, and the side effect that we found profoundly was dogs' incontinence really was affected very positively. So that might be something you're interested in. So, excuse me, I'm just going to cough again. Okay, so I'm just going back to the questions. And let me just see, we've got one more question in here. So Bernadette, another one from you. I'm really not talking about polyradicular neuritis because that's a neurological problem. So with legs paralyzed for 6 months, now walking with difficulties for a week, which, you know, I can really empathize how dramatic that's going to be. for the initial stages of rebuilding muscle. So that's muscle, that's not a muscle injury like we're talking about with stress and strain and contrusion. That's kind of another crowdcast on another day. But if you want to PM me, we could go through that. I'd be really, really happy to kind of identify that, because canine idiopathic polyradicular neuritis is paralysis due to acute inflammation of the neural tissue. So really different to what we're talking about this evening. But, you know, good question, Bernadette, always, but just PM me and I can help you with that. So if you've got any more questions, do put them there. It says I've got 2 more, but I'm just trying to find them. Thank you. Another one. Okay. We're going to be talking about continence. So we've got urinary continence. It's exactly the same. So really great question, Alex. What I'm talking about is incontinence in the dog, full stop, urinary or fecal. So tail work, body posturing work, focusing on coccygeus, definitely engaging the core, activity work, appropriate soft tissue mobilization and massage therapies can help as well. And it's a lot of proprioceptive balance work, but really getting those pelvic limbs or hind limbs engaging. And I think you may be very interested in the video showing some of our tail mobilization work that we've done for the past 10, 11 years. And we pass on in all our courses as well, our level 5 courses. I hope that helps. I think we've got a couple. Dave Taylor. Dave Taylor, which Canine TV? Dave Taylor. So, okay. Welcome, Dave. I didn't see you arrive. Didn't see you sign in. So when will the Canine TV be available? Which one are we talking about? So we're in production of huge number of Canine TVs. The one that was for April, if you can appreciate taking the videos, editing, scripting, waiting for the script, which is a gig by someone who is professional and does that. It takes a lot of time. So there is a Canine TV that I was offering for those who attend the Crowdcast for April. As soon as it's done, it will be launched. Then we will make sure we send out a drip broadcast. So everybody who's signed up will know it's there and it will sit on the website. Our website we're still in development of. And the Canine TVs for the tail work for the elderly dog will be within the package of doing that course, which will be online. And again, a great opportunity to be able to take our work in our clinic straight to you. So for those who are working in hydrotherapy, for those working in veterinary physiotherapy, whether land-based, water-based, for those musculoskeletal practitioners, you'll be able to see firsthand in the real clinic using these techniques, and then broken down in a workshop where we break down every element and show you how to do it so you can then practice those techniques yourself. And we also have just opened our Canine community, which is our forum. So everybody who signs up for a course has access to that, where we've got a huge number of extra resources, and we're building more Canine TVs that are just sitting in that Canine community as well for practitioners. So I think we've done that one. Okay, any more questions? Anything else you want to chat about? I hope you found that useful. I've just overrun by 10 minutes. I do apologize. I try to keep it to an hour. On the call to action, it should be there. I may not have done that properly, but if you go on the call to action, there should be a link that takes you to the Canine HS resources page. So if you would like to claim your CPD certificate for this evening's discussion, you're very welcome to go on there. It's free. You just have to put your information in. And part of doing your CPD is then reflecting on the information, how it affects your practice. Has it been useful for you? Has it given you something to go forward with? So again, that bit of reflection means you've done everything you need to do for your CPD. You've reflected on it, and then you've claimed a certificate. Thank you, Bernadette. I've got a really high temperature and I'm shaking a bit. It's exactly where I'm going to go. I'm going to go straight back to bed now and try and get over this virus. Thank you, Jane, for the feedback. In the chat box, do please let me know Oh, thank you, Peggy. I'm going to just bring that up. Very interesting information. I learned a lot. I like that you recommend taking the dog's response, anxiety, fear, or stress levels into consideration when we work with them. It's absolutely paramount to work with the dog, not on the dog. Some dogs are so stoic. I want to tell you this story. We've got this lovely mini Daxi who had the most huge extrusion of her disc. So she had intervertebral disc disease. She had several discs go. Her owner witnessed it, and this wonderful dog was so stoic, didn't utter a word, and no one knew until they did the diagnostics. So it was profound that you expect the dog to be shouting out, "No, this is terrible, I'm in pain." Lots of dogs don't. Sometimes it's just a behavioral change in the dog where they're not playing with their toys, they're feeling a bit flat, they're not really engaging. Some subtle changes are telling us that that dog is in pain. So it's really important that we think about the dog's response to everything we do with them, our introduction, our palpation, the way we approach the dog, the way we touch the dog, the way we analyse information, and really take on board the owner looking at the dog and telling you what they're feeling, they're seeing as well. So that's great that you felt that was important, because it's absolutely what we built our whole practice on. Thank you, Caroline. Yeah, I know. I have to be honest, Alex. Like 2 hours ago, I was thinking I'm going to have to cancel, but I'm like kind of propped up here. So it's been great again, another evening. And please look at the poll and please vote on the poll down there, because that's going to give me an idea where we're going to go. So what I want to do is explore things to help you develop and expand your practice so you're really successful out there. And at the moment, how to grow your referrals and get clients through the door has got 7 votes. Some people, they've really been asking me about their centre design, where they put things, how they arrange it for clinical enrichment, to maximise your service provision, the limitations and finding solutions, how to work around that. Water management solutions, I am PM'd a lot about, so if you want more information on that. So please do vote away, and that's something. Oh, thank you, Richard. And that's something that I will use to sort of structure a series. I'm going to do a mini 3 series now for June, July and August. And we're going to sort of centre it on about your professional growth and what we can do to sort of support you with that. As I said, it's great to have some feedback in the chat box. It kind of reassures me that I'm reaching a big audience that share my passion for dogs, and to support you, because we all work so hard. We all work really long hours, and we all are really passionate about the dog. So just to support and help each other, it's a great way to network. And I'm really looking forward to the next one. And I'm going to take your advice. I'm definitely going to get some more medicine and go to bed and get warm and try and get over my shivery shakes and my high temperature, because I'm meant to be at work this week. So I need to get better soon. Anyway, it's been a great evening again. Thank you so much for all the questions. I've really enjoyed it. And bye for now. And I'm just going to sign out again. Let's just close the video. So thank you very much for joining me. I really look forward to seeing the poll and seeing where you would like to take this and what you would like to cover next time. I'm also thrilled that there's other webinars out there that are following the topics that we're really causing a bit of a wave. You watch the other webinars that come out just before or just after the webinar, this crowdcast, and it's interesting. The topics are exactly the same. So it's having an impact out there. So it's great to network, get together, ask questions, share some time. And I really appreciate you coming live to the event. It means so much to be supported at the live event. And if you've missed it, don't worry at all, because the replay should be available literally in a couple of minutes. So you can go back to the questions, anybody wanting to just look at those questions again. Okay, cheerio, and I'll see you in June. Bye.